Good evening, and welcome to all of you to the November 12th meeting of the Board of Directors of the Washington Township Healthcare District. I'd invite you all to stand with me and join me in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Christine, if you'd take the roll call for us.
Director Stewart.
Present.
Director Wallace.
Present.
Director Nicholson.
Present.
Director Danielson.
Present.
Director Epen.
Thank you. Our first item on the agenda this evening is an educational session. I'll ask Nancy to introduce that for us.
With pleasure. Tonight, we're going to hear from Kimberly Alvari. She's our Director of Food and Nutritional Clinical Services. She received her undergraduate degree from Cal Poly in San Luis Obispo, graduating magna cum laude. Her postgraduate work was done at the University of California, San Francisco, where she was named the Bay Area's most outstanding dietetic student. Currently, she's an MBA candidate scheduled for completion next year. Her early professional career as a registered dietitian includes positions at the University of California, at San Francisco's Medical Center, and as a consultant to the Home Health Plus. Her years at Washington Hospital began as a clinical dietitian with a focus in critical care. The last 10 years have been spent in management of the clinical staff, and most recently as the food service director. She's a member of many professional organizations, including the Academy of Nutrition and Dietetics and the American Society for Parenteral and Enteral Nutrition. She is also a board-certified nutrition support dietitian. With that, I hand the program to Kimberly.
You want to change the world? You put garden boxes in where there once was blacktop. That's one of the first things that was done here at Washington Hospital to challenge the traditional practices of the supply chain for healthcare. Hospitals are really in a unique position to garner their purchasing power and their mission for healing to change that supply chain to focus on health and wellness for our patients. So tonight I'd like to share with you our story here at Washington Hospital. So our story has several chapters. We've got 5 chapters here. I'll give you a little background on how the story gets started. I'll focus a little bit on our mission of excellence, making friends and networks, how the story became possible, the story, the actual story, the telling of that story, and of course our patients. So chapter 1. The food system. I wanted to share with you a little bit about the food system. I think we all probably take for granted when we sit down to a table of food how simple it may seem. But the actual supply chain, the industrial supply chain, is actually very complicated and interwoven in many different ways. And so when you sit down to your table, one of the things that you can think about is that the industrial supply chain here in the United States, we import from over 200 different countries we import food from, okay? 10 to 15% of the food on your plate is coming from outside this country. Of that, 75% is produce. All of that comes in to the United States. About 1 to 2% of it is actually inspected, okay? And that may be changing now because there's some new laws on the food modernization, so that may be evolving. So I wanted to share that with you because this picture up here, it looks like a simple salad, right? This salad has 37 different countries that put that salad together on the plate. So that's how big the supply chain is. Also, food safety. So when you start to think about food safety, you look at the individual different components of the food system. And you'll notice that produce is the one that is involved with most of those foodborne types of illnesses up there. That's the one that causes the most problem. While it causes the most illness, of course, it's the meat and poultry that has a bigger problem in terms of actual mortality. So when we know where the food security and safety and how big our supply chain is, we start to look at what the CDC says in terms of current food safety challenges. Food safety challenges that we're faced at is looking at our food production and our supply chain, knowing where our food's coming from, what is transparent, how do we know how it's getting to our table. Changes in the environment that are affecting that supply chain. the rising number of multi-state outbreaks, and I think we've all heard about that. We've heard about cantaloupe in Colorado. We've heard about spinach. There's been a lot of outbreaks in terms of foodborne safety. And then new and emerging research that's been done on antibiotic resistance, and I think I'll talk more about that later, and I think you'll have a good understanding of that. So what's our mission of excellence here? What's our story start with here? It's really our concept of excellence. We ask ourselves in the food service department 3 simple questions. What are we deeply passionate about? And if we asked ourselves that, we said we're passionate about the fact that food is healing and food provides comfort. What drives us? Our patients drives what we do around here and how we provide the services that we do, so the patients are most important. What can we be excellent at? Well, we can be excellent at the culinary experience and delivering that to our patients. And so then it makes our mission very simple. Patients come first at Washington Hospital, every patient, every time. Our vision, to be the expert in translating the science and practice of nutrition into an excellent culinary experience for all of our patients. And with any good story, how does a good story get started? It starts where it ended. A good story starts looking forward and saying, where do we want to really be with this? And so that's what we did when we started to look at the supply chain for the hospital here. We started to say, what kinds of things would we like to be looking for in terms of the things we provide our patients? So while it may seem like there's a lot of simple words on here, it's not that simple. There's a lot of different things, local and organic and cage-free, non-GMO, non-trans fat. You can see there's quite a few things on here. We threw the net as big as we could on this project because we didn't want a ceiling on the choices and the things we would decide for our patients, so we aimed to go high with that. We joined the Healthier Hospital Initiative, which is healthcare without harm. We joined that to make a pledge as a hospital that the types of fanatical decisions that we would be making in terms of what we would provide would be those that looked at the best health and interest of our patients on every step. So we'd have to make friends, and we'd have to have other networks to get this work done. So we first looked at our produce partner, and I think you can understand why, because we talked about produce being one of the things that is related to foodborne illness the most. So we were looking for partners, and we had some non-negotiables when we were looking for our friends. We said that they must have the highest level of produce safety coming from their facility, that we would ask them to focus on things that we wanted to focus on, local and transparent supply chains, that we would know where our food was coming from, and that we would get optimal pricing from them, that all of that was something that we didn't really want to negotiate. And as with anything, when you go out looking, what you usually find is what you're looking for is in your own backyard, okay? The best produce provider we could find is right here in Alameda County, okay? It's just up the road. They provide the safest quality produce, and they were willing to work with us to look for more local produce that's coming from small to medium farms. So it became a win-win for us and a natural partner. We had other friends that we picked up along the way to get this mission accomplished. We have some local bakeries that we worked with, and we visited those bakeries. I actually visited our produce supply place. We went up and looked at it. We watched how they move food through their system and made sure that we liked their practices. We did the same with the bakeries, and we also asked them to do some special things for Washington Hospital that we were interested in making here for our patients. Joined the regional produce project partners, and we joined the hospital leadership team to get some more friends along the way. So here it is, the San Francisco Bay Area leadership team. When I joined this 2 years ago, there was 5 hospitals on this team. You can see how it's grown now in the last year. There's 16 hospitals participating, and you can see Washington Hospital down there, almost to the farthest south and almost the farthest east, but we're right there on the map, and we're one of the original 5 hospitals to join and make this commitment. You can see our name posted on the Physicians for Social Responsibility. It's a hospital that's made the pledge to make important decisions along the way, and you can see a little copy of that. We've been good friends for the last couple of years. Hospital leadership goals, these are the goals of the leadership team that we belong to. Really leverage the collective buying power, and I mentioned that when I opened up. I said as hospitals, we stand in a unique position to really pull together and aggregate that purchasing power and kind of drive the types of changes and things that we'd like to have. So we'd share also innovative strategies. How could we get that done? And I'll share one with you in just a minute about the antibiotic-free meats that we purchased. Put food at the center of healing, which of course all hospitals, especially, we're interested in. Make sustainable food choices when we can and focus on that. And then educate. And it's part of what I'm doing tonight. I'm telling this story. And we told this story over and over so that people would understand what we were doing here. And then we would have metrics to measure how well we were doing. How was it going? Are we on the right course? Do we need to correct? Is everything going the way that the hospitals would like it to go? So now I'm going to tell you a little bit about the story then. We've got our friends in tow, and now we've got the story. So I'll tell you about our farms. August 14th last year, I went out to our farms. Our farms are that close. I went out to Brentwood, and I was able to go to Dwelly Farms and go out there and actually meet the farmers. Most of the farms that we're working with through our vendor, local right here, is Koch Farms, Durst, Dwelly, and Zuckerman's. We were out at Dwelly, out in Brentwood, so I was able to go out there on August 14th, like I said, and meet the farmers. So I'm going to introduce to you our farmer as well. That's our farmer. He brings green beans to this hospital. And I'm sitting in the patch of green beans up there. Those are our green beans, or maybe it might be another hospital's, but I know they're one of the leadership team's green beans. So I had the privilege of looking at those green beans, and within days later, we're serving green beans in the cafe and to our patients, and I'm thinking, I saw those green beans. So that's how close, that's how visible. And when we go out and visit the farmers, one of the things that we're able to do is really have good conversation over lunch about the good agricultural practices that they have in place, the problems that they face in terms of the Food Modernization Act and what's going on. So we really know the story of our food that we come to eat here at Washington. So our collective work, this is part of the regional produce project that we joined. This is some of the collective work in pretty much the first year that we did this. In 2012 to 2013, we would look at the metrics and measures of the total pounds of produce that we negotiated with the farmers that I shared with you, and it's close to 30,000 pounds of produce that we negotiated with these farmers. We know hospitals make a difference because Koch Farms increased their organic strawberries production by 30% to meet the demands of the hospital, Washington Hospital included. So you can see that we can make change when we get together as friends. More of our story. Other things going on, we have hormone-free milk here, cage-free eggs, fair trade coffee, and antibiotic-free meat. And antibiotic-free meat is one of the newest things here at the hospital. It came in the summer of 2014, and that became a part of responsible antimicrobial stewardship. I mentioned that the CDC mentioned that they had a concern that there's a connection with everything from the agriculture to the food supply chain, and that antibiotics, 80% of the antibiotics are actually used in agriculture and not used in medicine. So that's an important fact. They're used because animals are kept in close quarters, and they're used to get the animals to bring them to slaughter faster. So there's something in the growth process that helps do that. And so with that, they wanted to start to look at that and say we need to kind of make some changes in terms of antibiotics. And I'll tell you, one of the things we were able to do with the leadership team was we were able to go out and broker privately with our vendor for our antibiotic-free meats through our prime vendor, and the leadership team actually did all the brokering. So we were able to set up the hurdles, the tiers, get the pricing that we wanted, and actually set up a program that the hospital gets rebates on, something that would not have been possible without that leadership team. So we also celebrated our antibiotic-free meats. We joined up with Healthcare Without Harm on October 24th to change the world just a little bit. And we did that by serving antibiotic bourbon chicken. Bourbon chicken's one of our favorite items in the cafe and patient tray line. And we served it with a local organic butternut squash. We served it tray line to patients, and we served it in our cafe. And that was our little day to say we would change the world in just a little way. We did that also by posting to the food blog for that day, for Food Day. So you'll see Washington Hospital got the top spot on that Healthcare Without Harm food blog, and our participation in our sustainability program here at the hospital. So that was another way to tell our story. Storytelling happened before that. Went up to UCSF a year ago and told our story up there to a bunch of people who came to hear about balanced menus and healthy feeding in healthcare. So that's really kind of where the story got started. We like stories, and we like stories that get bigger. Who doesn't? So this year, Practice Green Health Environmental Excellence Award of 2014, we were awarded as a hospital. I'll say the food service had such a small piece of that, but we're still a piece. And our part of it was that we reduced the number of sugary beverages and offered alternatives within the hospital, as well as decreased our meat our meat purchasing. Now, I want to make a comment about the meat purchasing. Here at Washington Hospital, if you know anything, this is a primarily plant-based hospital, and that's just our community and what we do here. So to make a change and reduce the meat consumption or the amount that we provided was a significant, difference, even though very, very small because we already are a plant-based diet. We provide tray tents for our patients because we want them to meet the farmers. They didn't get to go out to the farm like I did, so we have tray tents that actually introduce them to each one of the farmers to Durst. And so when we provide the butternut organic squash or we provide the produce, we send a little tray tent and we say, this is where your produce came from. Meet your farmer. I hope you enjoy that. We do a lot of community events. We recently did a chili cook-off, a vegetarian chili cook-off, so we're able to go out there and talk about our food program here at the hospital. We did breast cancer awareness in Think Pink Month in October. I think you're going to hear about it a little bit later tonight. So we take it out to tell our story everywhere we go. I shared with you the Food Day information in our food blog as well. Our patients. There would be no story without patients, so this is what we're here to talk about the most. We like to listen to our patients because we know 7% of any kind of communication is really just the words. The rest of it is what you do. So everything that we're doing and the food that we put on their plate, we want them, when they taste that food at the bedside, to know there's a story. There's something going on here. It's not just food. So besides that, we listen to them. We listen to compliment cards that we get. We have a patient satisfaction survey that we have. We get meal tickets back, and I'm going to share more about meal tickets because those are our favorite. We do rounding on the patient care units. We actually go up and talk to patients at the bedside and ask them what they think about the food and what we're doing here. We have culinary rounds, and I've shared that before. That's when we go up and share our food program and our meals and things with staff on the floor. And this month, for the first time, those patients that are appropriate will participate in culinary rounds here at Washington Hospital. We also have hospitality cards. Those are little touch point cards. We may go by and see a patient and they're busy or sleeping, but we don't want them to know that we weren't there. So we leave a little card and tell them to give us a call if they need anything. So we do that. I also mentioned that here, that our favorite thing about listening to our patients, because of what they say, are the tray tickets that we get back. And I don't know how patients communicate to other people in the hospital and other departments, but when we send a meal ticket up, and you can see a little copy over there, when we send this up to the patients, it's got their meal for them. So many patients will grab these tickets and write us a little note and send it back. So I collected piles and piles of notes, and I thought, I want to share the note tonight. So when I was getting ready, I thought, where's those notes? And I had just passed them on to someone else to share them. So I didn't have any notes. And I'm like, I need some notes. That's our favorite thing. So I thought, well, I'm just going to have to tell them about it. But the other thing about the note, and I want to share this, the food service employees within our department understand our mission. So there was a weekend where one of our employees, Ryan, got a meal ticket back, and he read the note. And he said, I got to talk to that patient. So he got the tray mat out, and he wrote a note back, and he said, I got your note. Thank you. If you need anything, I'm Ryan. Just call. Send it up. I happened on the following Monday to be making meal rounds. I ran into that patient. He was more than ecstatic. He said, I gave you a note and you talked back. You listened to what I said. I got a note from one of your employees, and I said, I know who it was because he shared this story. So that's what we do every day now. We write them back. So last night, in desperation, having no notes and thinking I was going to have nothing to share with you, what happened as I stepped out of my office at 6:15, one of our food service staff came downstairs and said, Kim, I have a note from dinner. And I said, give it to me. So what you notice on the note, it says Tuesday. It says dinner. It says 11/11. That's yesterday. That's about as quick as it gets. And we like these notes because what? These patients are in the hospital right now. They're talking to us immediately. It's real-time communication, and it gives us an opportunity to get back with them. So what did I do? I grabbed a placemat. I put our hospitality card on it. I put my business card on it. I said, thank you for sharing. Call us anytime. And it went up for breakfast. This morning I followed up and went up and saw him about 10 o'clock this morning and said, did you get the note? And he said, yes, thank you very much. So you can understand these are the most as personal as it get, and why we are so excited when we get to have a meal tray ticket come back down. So we continue to do it. So work worth doing, we do a lot of work worth doing within our department. It's well thought out, it's of positive intent, And if something like that's going to happen, you know that it's been done with intelligent effort and design behind it. So that's everything, the story within the department. So we've put the garden beds in place. I told you if you want to change the world, put some garden beds out on the blacktop. That'll start the change. Meet some of the agenda items, and we made some really, really good friends that are going to help continue this story. And what I want to say at the end is, I say this 2 weeks ago, I met with a member of the leadership team. She came by and saw me and she said, Kim, you're doing incredible work at that hospital. And I said, thank you, but I'm not. It's the people in the food service department are doing the work, and it's all of our friends. Because honestly, none of this would have been possible without all of the good friends that we have. I would not have been able to get farmers to grow me strawberries. I wouldn't get them to help negotiate contracts without all of the good friends that we have. I just get to be the beneficiary and be able to tell the wonderful story and tell you all about it. So thank you very much. The story will be continued, and if you have any questions, I'd be happy to take them.
It's always fun when you come and tell us about the food services.
Good.
It's exciting.
Thank you. That's it.
You know, that seems to be a really big subject with people, food at the hospital. And it's nice that we're doing such a great job there.
Thank you.
Appreciate your work.
I have one question.
Sure.
You have the picture of the garden beds.
Correct. Nothing's
Where are those-
growing?
Where are those at?
Oh, you know, this is, the helipad is just in front of it. So just in front of the helipad,
Okay.
they sit, I don't know, I guess, is it west or east or? West, I guess, west.
We're going to have to move them for construction.
Are the beds actually made out of brick? I can't tell.
They're actually wood. They're wood
Wood?
framed. Yeah, they're wood framed.
Okay, because
And
that's
this
what I
is-
have, is wooden frames.
Yeah. Yeah, so they sit just outside the helipad there and
Yeah,
stuff.
those
so-
are large.
Yeah, we get a lot of produce out of those, so they might be small, but we get a lot of produce.
Okay.
Okay, thank you
Thank
so
you.
much. All
Any
right,
other questions?
yeah,
Two questions.
sure.
First of all, such great work.
Thank you.
Really love it.
Thank
And I
you.
know the patients do too. First question is, how does the general public know whether they are procuring antibiotic-free meat or not?
Okay. Typically, I mean, it'll be, when you shop, you'll actually see that. And actually, what's exciting for me now is at many stores, and I won't mention names, but at many stores, it used to be just in really high-end specialty stores that you could go and pay lots of money. I can tell you in some of the, you know, the broader, less expensive stores, I'm seeing those option terms, and it'll actually be labeled antibiotic-free, grass-fed, and it'll say never ever on it. Never ever means they've never used antibiotics in the processing of that animal. So never ever is what they're looking for.
Great, so look at the labeling.
Yeah.
Second question is, you mentioned the Food Modernization Act.
Correct.
Can you tell us a little bit about what that is and what it does?
Correct. They've just, they're still taking, I believe they just finished taking comments back. So it's the federal government law that was put into effect, I want to say 2011, 10, 11, late. So they're taking comment on it. They're working on section of it. So it's rather large, but what the intent of it, some of it, it's very large, but the intent of it is to try to then, you know, actually go out internationally to these countries and inspect their food systems out there and kind of hold them accountable to the kinds of regulations that the United States has. And so you can imagine how big and global that is, how much energy and how much time it's going to take to kind of get that all sorted out. They're also trying not to lose some of the really small farmers in the process. There's some really good farmers doing work, and some of the law might cut them out of, you know, the actual ability to bring stuff to market. So they're trying not to hurt those farmers as well. So it's really getting sorted out, and it's pretty large. It's pretty complicated. I think it's going to take several years to get it kind of ironed out.
Great, thank you
But the
very
intent
much.
is good, I think.
Thank you.
Okay, thanks.
Thanks again.
Thank you so much.
Our next item will be the consideration of minutes. I'll entertain a motion on that from somebody.
Mr. President, I move for approval of the minutes from October 8th, 20th, 22nd, and 27th.
Have a motion
Second.
and a second. Any comment on that? Any discussion? Call for a vote. Christine, if you'd take the vote.
Sure. Director Stewart,
Aye.
Director Wallace.
Aye.
Director Nicholson.
Aye.
Dr. Danielson.
Aye.
Dr. Eatman.
Aye.
That motion passes. Thank you, Christine. We'll now have time for communications. Are there any oral communications this evening that we need to consider? Seeing none, we'll move to our written communications and hear first from Peter Lunny, our Chief of Staff.
Thank you. The credential action items from October, we have 6 new appointments. Dr. Aaron Berry, anesthesiology. Susan Glauberger, a physician assistant. Dr. Roger Goldberg, ophthalmology. Dr. Kenneth Lean, allergy and immunology. Dr. Alan Shotkin, pediatrics. And Dr. Hang Tang, emergency medicine. One of those applicants also was extended temporary privileges after the medical executive committee while the application is in process. That is the physician assistant, Susan Glauberger. For reappointments, Dr. Michael Bostash, radiology. Dr. Ashwani Bindal, internal medicine. Dr. Kwanshan Chen, cardiology. Dr. Murali Duran, cardiothoracic surgery. Dr. Asol Dolgosheva, pediatrics. Dr. Katerina Guzman, internal medicine. Dr. Nancy Wah, internal medicine. Dr. Soham Javari, internal medicine. Dr. Christina Lee, pediatrics. Dr. Connie Lee, internal medicine. Dr. Brian Lipson, allergy and immunology. Dr. Diane Martin, infectious disease and internal medicine. Dr. Kevin Morrissey, emergency medicine. Dr. Norma Paragas, pediatrics. Dr. Gershron Reen, cardiology. Dr. Shaista Shah, internal medicine. Dr. Ramesh Viragandam, cardiothoracic surgery. Stephen Watt, DDS. Dr. Richard Wright, otolaryngology. And Dr. Stanley Yu, gastroenterology. Conditional reappointments, Dr. Gershron Reen, a 6-month conditional reappointment. Non-reappointment deemed to have resigned, Robert Shu, PA. Transfers in staff category, Dr. Murali Duran and Dr. Ramesh Viragandam will be going from provisional to ambulatory. Completion of proctorship and advancement in staff category, Dr. Elizabeth Ady, OBGYN. Dr. Joseph Deck, anesthesiology. Vineet Kambaj, podiatry. Dr. Philip Lee, internal medicine. And Dr. Richard Wright, otolaryngology, have all completed proctorship. And finally, resignations. Dr. Fogarty from Radiation Oncology, Robert Chu, physician assistant, Dr. Thomas Lee, radiology, Dr. Anna McNay, dermatology, and Dr. Sun Paik, pediatrics.
Thank you, Dr. Lunny. Do we have a motion on that?
So moved. Second.
Motion and a second. Are there any discussion on that issue? Christine, if you'd call a vote.
Dr. Stewart.
Aye.
Dr. Wallace.
Aye.
Dr. Nicholson.
Aye.
Dr. Danielson.
Aye.
Dr. Epen.
Motion passes. Thank you, Christine. We'll now have our Service League report from Gail Tomita.
The gift shop had their annual holiday show on November 6th and 7th with holiday music and holiday treats. The gift shop is well decked out for the holidays, so I hope all of you will have a chance to go in and do some shopping. This Friday, they will be having the drawing for the featured items, so if you haven't bought your tickets, please do so. The $5 jewelry sale is coming back in time for the holidays, and it will be on Monday, December 1st, from 7 a.m. to 6 p.m., Tuesday, December 2nd, from 7 a.m. to 6 p.m., and Wednesday, December 3rd, from 7 a.m. to 5 p.m. The sale takes place in the Anderson Auditorium at Washington West, and the proceeds from our annual, benefit our annual hospital donation. So please come by and have all your friends and family come and visit us. that's it.
Jewelry sale is always a fun event.
Yes.
I have many, many granddaughters. And it seems like it's getting more popular every year with that group.
We enjoy having everybody come.
It's nice. It's a very nice event, some actually very nice things.
Right.
Now, back to our medical staff. Dr. Lunny.
Okay, our medical staff continues to expand. We have 553 total medical staff members, 303 active members, 98 provisional, 28 courtesy staff, 3 consulting staff, 67 ambulatory members, 3 administrative members, and 21 allied health professionals. The largest department is the medicine department with 215 members, surgery 131, family medicine 45, pediatrics 68, OBGYN 39, anesthesiology 28, and radiology with 27 members. We currently have 15 applications in process, 6 with pre-applications and 9 with formal applications.
Thank you. Thank you. Now move to our hospital calendar. Nancy, if you could present that for us.
Thank you.
Past health promotions and outreach events. Throughout October and November, Lucy Hernandez, Community Outreach Coordinator, presented 36 hand hygiene classes for students at Briar Elementary, Hirsch Elementary, Olivera Elementary, Patterson Elementary Schools in Fremont, Lincoln Elementary and Music Elementary Schools in Newark, and Guy Emmanuel Elementary School in Union City. Information was provided on proper hand washing and hygiene to prevent infection and spread of germs. 954 students attended. On Friday, October 10th, Lincoln Elementary School in Newark held a walkathon. Washington Township Medical Foundation staffed a booth and provided health information for students, teachers, and parents. Over 400 people attended. On Tuesday, October 14th, Washington Hospital hosted the 6th annual Think Pink Breast Health Awareness event. The event featured a health fair and presentations by Dr. William Degoni Jr., surgeon, Dr. Mimi Lin, radiologist, Dr. Vandana Sharma, oncologist, and Kimberly Alvari, registered dietitian. Dr. Victoria Leapart, gynecologist, moderated the event. Over 250 people attended. On Tuesday, October 21st, as part of the Washington Women's Center Evening Lecture Series, Lori Roffelson, registered dietitian, presented The Enemy Within, Sodium. 8 people attended. On Monday, October 27th, Michelle Heading, RN, Spiritual Care Coordinator, presented to participants of the Friendly Visitor Program at Life Elder Care. The presentation was on advanced healthcare directives. 25 people attended. On Tuesday, November 4th, as part of the Stroke Education Series, Dr. Ash Jain, cardiologist, and Luann Sadweste, registered nurse, presented stroke and risk factors for stroke. 20 people attended. On Thursday, November 6th, as part of the Diabetes Matters program, Anna Mazet, registered dietitian, presented Sweet or Sour, the Scoop of Sugar Substitutes. 21 people attended. Upcoming health promotions and community outreach events. On Friday, November 14th, from 2 to 4 p.m., Dr. Alexander Saw, orthopedic surgeon, will present Treatments for Hip Pain. On Saturday, November 15th, Washington Hospital will host the 6th Annual Diabetes Awareness Health Fair. The event will feature a health fair and presentations by Dr. Prasad Kata, endocrinologist, Dr. Archana Bindra, endocrinologist, and Anna Mazet, registered dietitian. On Tuesday, November 18th, from 1 to 3 p.m., Dr. Gabriel Herskew, vascular surgeon, will present varicose veins. The Washington Hospital Healthcare Foundation report. Washington Hospital Healthcare Foundation held the 28th annual Top Hat Dinner Dance on October 11th. The event raised over $224,000 for the Washington Special Care Nursery, which is affiliated with UCSF Benioff Children's Hospital, San Francisco. 705 guests attended the evening, which began with a cocktail party, followed by dinner, auction, and dancing until midnight. Co-chair Rod Silvera commented, "Everyone loved the Gatsby theme of the evening. The venue looked beautiful, and the donors and sponsors were incredibly generous in supporting the babies served by the doctors and nurses in Washington Special Care Nursery. Thank you to everyone in our community for doing so much for the foundation." Mark your calendars to attend the 29th Annual Top Hat on Saturday, October 10th, 2015. In December, the Washington Hospital Healthcare Foundation will host the annual Tree of Angels for Hospice 2014 tree lighting ceremonies and holiday events. Tree lighting ceremonies will be held on Monday, December 1st at 6:30 p.m. at Newark City Hall, on Tuesday, December 2nd at 5:30 p.m. at the McDonald's on Mission Boulevard, and on Wednesday, December 3rd at 5:30 p.m. at the Nakamura Clinic in Union City. On Saturday, December 6th at 8 a.m., the Foundation will host the Children's Holiday Breakfast featuring Ronald McDonald and Santa at Washington Hospital in the Conrad E. Anderson, MD Auditorium. This event is $10 per person. Pre-registration is recommended. The last tree lighting ceremony will take place on Thursday, December 11th at 5:30 p.m. This event will feature both the tree lighting and a high school choral competition. This event will be held in the Conrad E. Anderson, MD Auditorium. The Washington Township Healthcare District Board of Directors report. Washington Township Healthcare District board members attended the 15th Annual Senior Resource Fair hosted by the City of Newark Senior Center on October 7th. The Senior Night Out, hosted by the Tri-City Elder Coalition on October 17th, and the State of the State Address, hosted by the Fremont Chamber of Commerce, October 31st. Washington Hospital Employee Association, WIA. WIA was busy with many activities during the month of October, including organizing a pumpkin carving contest for employees and launching the annual Seas Candy fundraiser, allowing WIA members to purchase discounted Seas Candy gift certificates now through November 19th. WIA is also in the process of conducting a drive for warmth, collecting blankets, sweaters, coats, mittens, hats, and scarves to be donated to the Tri-City Volunteers, which provides emergency food, clothing, and furniture to those in need. Donations are being collected in the lobby of the Washington West Building and the cafeteria on the ground floor of the main hospital through November 14th. Washington on Wheels, WOW! Mobile Health Clinic. During the month of October, the Washington on Wheels Mobile Health Clinic, WOW, continued to serve community members at the Fremont Family Resource Center, Fremont Senior Center, the Silliman Activity Center in Newark, and the New Haven Adult School and Ruggieri Senior Center, both located in Union City. They also visited Briar Elementary School in Fremont. WOW also provided occupational health services, including influenza vaccines, to Columbus Foods, a producer of fine foods, Materion, an advanced material solutions company, Lee's Imperial Welding, producer of structural metals, Mizuho OSI, which manufactures specialized surgical tables, Matson Technology, a semiconductor manufacturer, and AER Worldwide, which provides e-recycling, IT asset management, data security, and value recovery. These companies are located in Fremont, Union City, and Hayward. The total number of community members receiving health care at the Washington on Wheels Clinic during the month of October was 358, with 306 receiving occupational health services. Internet marketing. Washington Hospital's website remains very active. The hospital's Physician Finder section was October's most viewed webpage with 15,331 views. InHealth, Channel 78. During the month of October, Washington Hospital's cable channel 78, InHealth, taped new programming, including a Diabetes Matters program, When You Care Too Much, giving the right kind of support to a loved one who has diabetes, and a health and wellness seminar, The Enemy Within, Sodium. InHealth aired new programming, including 3 updated West Nile virus public service announcements and the October Board of Directors meeting. Awards and recognitions. On Saturday, October 18th, Washington Hospital recognized over 150 employees for their years of service. 2 awardees were recognized for 40 years of service, and 1 awardee was recognized for 45 years of service to Washington Hospital. Combined, the awardees have provided over 3,455 years of service. For more information on any of the programs mentioned, visit whhs.com or call 1-800-963-7070, and please follow us on Facebook and Twitter.
Before we get to the Employee of the Month, I wanted to just comment briefly and remind the board that we're in the strike period where the nurses have walked off the job at Kaiser starting Tuesday at 7 in the morning and returning Thursday at 7 in the morning. My understanding is that while they're in negotiations, they have yet to discuss pay in their negotiations. And the stated purpose of the strike was to protest the lack of preparation and training for the care of Ebola patients. Also wanted to make sure the Board of Directors was aware that with the proposed transaction that would convey the Daughters of Charities hospitals to Prime Health, SEIU has filed a class action lawsuit over the Daughters of Charities pension plan. They allege that the employer underfunded the pension plan, and a sale would further jeopardize that retirement benefit. They also have stated their opposition to the sale of the Daughters of Charity Health System to a for-profit chain, Prime Healthcare Service. The suit claims that the Daughters of Charities pension plan was underfunded to the tune of $229 million as of December 31st. So we'll be following that carefully and see how that goes. I also wanted to just mention briefly that with the Republicans having such a strong showing in the election, that we expect an intensified fight against Obamacare. While it is unlikely that they'll be able to repeal the act, I think just about everybody on both sides will say that. There are likely targets, and it looks like they'll go after the individual and employer mandates, the 2.3% excise tax on medical devices, and the health insurance tax. And so they're expecting those things to be targets for change. The likely course of events will be that the Republicans will hold a series of votes under standard legislative rules to strike down important provisions of the law, forcing the Democrats to go on record voting against the repeal in preparation for the 2016 election. That's pretty much what the experts are predicting in Washington, D.C. over the course of the next couple of years as we head into the next national election. I'm very pleased to present to you Karen Manning, our November Employee of the Month. She came as a graduate student intern in 1990 and has been employed at Washington Hospital since March of 1999. She's a valuable member of the speech pathology department. She's extremely conscientious, willingly takes on extra duties as assigned, and ensures that the needs of the department are being met, communicates extremely well with her peers and manager, and is someone who consistently goes the extra mile for her patients. She is dependable, reliable, and an extremely hard-working colleague. And I think she has the respect of all the patients as well. She lives our patient-first ethic. She's a team player, and that's always important here. And she has an extremely positive attitude and an energetic personality when treating patients or working on department projects. First and foremost, she's a patient advocate. She listens carefully to her patients' needs and takes time to follow through with whatever medical necessities are indicated. And if it's to reach out to nursing, social services, or another ancillary service, she's absolutely willing to do that. She has 2 kids, both are attending college, and according to friends and family, she is an incredible cook and considers herself a foodie. So I say congratulations to Karen, a wonderful Employee of the Month.
Thank you, Nancy. We'd like now to have our construction report from Ed Fayen.
Okay, so we have multiple projects to report on today. First is the Civic Center Drive improvements. So as you might recall, we've had presentations here at the board meeting in the recent months. And we, Kieran Wright went to put in our plans, and they were met at the city with a comment that these plans needed to first needed to coordinate with the water department and make sure that all those needs were met. And so Kieran Wright went there, and we were informed that as part of this project, we need to replace 970 feet of water main that goes down Civic Center Drive, and so those needed to be incorporated in our plans. So of course we didn't budget for that, and they estimated it to be $100 a foot, so that's another $100,000 in the project. But we'll go forward. We already have incorporated that in plans and submitted it to the City of Fremont by the middle of October. We have not gotten approval yet on our plans, so we await to hear from them. We expect to hear sometime this month in terms of approval of those plans, and then we will go out to bid and deal with whatever happens in terms of our budget at that time. So another thing I wanted to talk about a little bit today, which we haven't talked about in a while, is the Center for Joint Replacement and Central Plant Projects, which were completed in 2012. And the noteworthy thing I wanted to talk about today is that we have finally reached agreement with Swinnerton Builders on all outstanding issues and any disputes that we had on this project. And we have signed agreements to finalize the project and make final payments on the project. As you might recall, this project was completed on time, and as you can see here, we completed the project under budget by about $2 million. And I think it was highly successful due to a number of issues, and I think a very strong team from the point of view of we had good drawings on this project from the architects. I think Swinnerton Builders did a very good job on this construction project, and I think Jacobs Engineering and Ray Graves also on our management side did a nice job. So the project was completed under budget by a substantial amount. And I think what's noteworthy is this is the largest project that we've had here at Washington Hospital probably in the 40 years since the 6-story tower was built. And so I think this was really a hallmark project for us.
I just want to interrupt. This is a public works project. It's a government project. And I can't think of one in recent history in our state that has come in $2 million under budget. This is a real accomplishment.
You should receive thanks yourself.
Thank you, Dr. Stewart. The other thing I wanted to just point out is, again, on this project and change orders, you might remember that once we got into the project, we changed the scope, and we added a, depending on how you look at it, a second or a third floor on the Center for Joint Replacement. Second floor, there's a basement. And that was originally not in the scope of the project. We decided to add it, and that change order represented the $5.6 million in change orders. So when you're looking at it in terms of what was our change order percentage on the job, all done, all complete, no disputes, everybody happy, it was 2%. And so again, I think another hallmark of a project that really went very well. On the parking garage, I just have a few things to say, and that is that we have, the job has gone out to bid. The bids have been completed, and a guaranteed maximum price set, which is all within the budgets that we've gone through here and had approved by the board. We have contracts to sign with all of the subcontracts, which we anticipate getting done here in the next week, and then we're going to be moving forward. And the parking areas behind the hospital are going to be closed down to staff on Monday. And we have parking on the other side of Bart Way that has been leased for staff. And we anticipate ramping up and starting this project, and we've got the completion date of next year around Christmas. On the Morris Hyman and Critical Care Pavilion, we have gone out and bid the first couple of packages here, and this is, I wanted to bring this forward just because I think it's noteworthy in that before we changed over to Rudolph and Sletton, the first bidding that occurred came in just with one or two trades, and it was they came in almost $1 million over budget. So for the first results that came in with Swinnerton Builders, you'll see that we came in under budget in terms of those bids under what we anticipated. So this part of the project is, while it's bid now and we have subcontractors selected, the shoring part of it has to go through OSHPOT approval. So that's what they're in the process of now. And they're anticipating a start date in February. Could be earlier if things happen, but our expectation is in February. We now are out to the next level of bidding, which represents 80% of the project, all the major mechanical, electrical trades. We anticipate getting bids in January 13, and then obviously evaluating them and then coming forward to the board. So focus right now is on these February dates to get this project started. Any questions that I can answer for the board on these projects?
Thank you, Ed. Again, congratulations on the joint replacement and central plant. It really was a stunning project.
Thank you.
Very, very exciting to see that all wrapped up and completed. Any other questions or comments from the board? Thank you again, Ed.
Thank you.
We'd like now to have our quality report, Mary Boron.
Good evening. Thank you, Dr. Stewart. It's time again to start thinking about influenza season again. So I wanted to take a few minutes to talk about our plans for this season in influenza. Just to remind you of what influenza is, the short-term name that you typically hear people referring to it is the flu. It can end up being a real serious respiratory infection that can cause people to develop further complications if it's not treated early. And it's very easily spread this time of year through people coughing and sneezing, and it's spread by those droplets that occur when people cough and sneeze. Flu season is considered October through March. By the CDC is designated that as being the higher level than the rest of the year that you see patients with flu. We like to really stick to looking at the CDC guidelines for flu every year, and they've made some recommendations, and that is that everybody receive an annual flu vaccination, even starting with the age of 6 months and older, and you can start looking to get your vaccination around October every year. In addition to that, they really recommend people follow some preventative actions, such as always making sure that you wash your hands, staying further away from people who are currently having flu, especially symptomatic people that are coughing and sneezing. And if you yourself is sick, typically if you can stay at home, it's better because that, decreases the risk of spreading it to other people in your area. It's especially important for people who are at high risk for getting ill. These are people who are typically immunocompromised. Children between the ages of 6 months and 8 years really should be getting the flu vaccine. And some of them, you may even need 2 vaccines that are done at 2 doses. Pregnant women are also another high-risk group that we like to make sure gets vaccinated. Adults 65 years or older, and people with chronic disease. These are people with heart disease, asthma, and cancer. Obviously, there's exceptions to people who should get the flu vaccine. These are people who have an allergy to eggs, and of course, children under 6 months of age. How the vaccination works is every year they do research, and based on their research, they can come up with a recipe for the vaccine that will be what they think is going to be the prevalent one out there, and they make that into the vaccine, and that is how they determine which vaccine people should get on an annual basis. The reason why it's necessary to have it on an annual basis is because, again, the virus changes every year, and they change the vaccine related to that. And because as the year goes on, you're less protected. The effectiveness of the vaccine starts to wear off. And again, like I mentioned before, you can have complications if you have the flu, such as bacterial infection, or it can go into a pneumonia and lead to complications that would make you likely to be hospitalized. So in looking specifically at our influenza season, they are recommending for kids between the ages of 2 and 8 to get it, and one of the new recommendations is that this group should get nasal spray, which is nice for a couple reasons. If you've ever had to take your kids in, the nasal spray is a lot easier to approach than a needle, so I was glad to see that change in that recommendation. And they also typically have made it up to be effective against H1N1, influenza A, influenza B, the common influenzas that you hear a lot about. At Washington Hospital, we've taken the approach of screening and vaccinating all eligible inpatients. So every inpatient that comes into this hospital right now is screened and asked if they've had their vaccine, and if they're eligible for it, we get that for them prior to discharge. The other thing that you've seen, it's sort of happened across the United States, and 2 years ago it happened here in Alameda County, that we had it was a requirement from the Alameda County Health Department that all healthcare workers have to get their flu vaccine. So we've been working on helping our healthcare workers get vaccinated. We do blitzes, we do a lot of education. Employee Health really works with them to come in and make sure that they can get their vaccine. And then we go over to certain areas of the hospital and make it as accessible for them as possible. And also, the Alameda County continues to focus on the need for hand hygiene. If an employee cannot get the vaccine, we require that they wear a mask in patient care areas. In addition to this, even beyond the county level, we have Joint Commission and the Centers for Medicare and Medicaid Services have really started to recognize the importance of this. So in January of 2012, they required that we report this data to them. We report to them our employees that are vaccinated and our inpatients that are vaccinated for flu. And some of that data is right here. You can see this shows you the last 2 flu seasons broken into 3-month increments. And we've had a lot of success with making sure that we can prevent our patients from getting influenza right up through the beginning. You can see the last one was 96%, which is good. That's about 4% higher than the rest of the nation. And specific to the healthcare workers, you'll see 91.3% last year, and then, or the last flu season, we were also at 91.6. This is much higher than you will typically see before these mandated vaccines were put in place. I mean, hospitals have struggled to get employees at even higher to 50 to 60%. So to see your employees vaccinated at 91.6% is really a good success that we're happy about. So as far as the community goes, again, they should start thinking about getting vaccinated in October. And there's been a lot more availability of the vaccine. So specifically here at Washington Hospital, we have our urgent care open. It's open from 8 a.m. to 8 p.m. You don't need to make an appointment. You can come by, get your shot. That's usually a pretty fast process. And if you in particular want to pay in cash, there's a discount for that. And recently, just in September of this year, Medicare B, Part B, made this 100% covered. So that was a good step in making it more accessible for people. Any questions?
No.
Great.
I think all of us are vaccinated.
Vaccinated, just like me, got it on your badge. Thanks.
Thank you. Now we have a finance report from Chris Henry.
Okay, thanks, Dr. Stewart. Tonight we'll be looking at Washington Hospital's operational and financial results for September 2014. Looking at our acute inpatient statistics, our average daily census for the month came in at 147.7, about 6.5 below the budget. We had 1,026 admissions, which were 74 above the budget. However, our patient days were 193 below budget at 4,432. Our outpatient observation equivalent days were about 16 above the budget at 258. Our average length of stay for September at 4.39. We'd expected 4.86 for the month, so you see the relationship between our admissions and our patient days. Looking at utilization, the case mix index for the month came in at 1.449. We'd expected 1.505 in the budget. We had 163 deliveries in September, 15 above the budget. Surgical cases were 20 above budget at 362. That includes our joint replacement cases that were pretty close to budget at 117. We had neurosurgical cases that came in 5 above the budget at 30. Our cardiac surgical cases, 1 above the budget at 9. And so OR had a pretty good month, pretty busy in the OR. Cath lab procedures were 211 above the budget at 738. We continue to see growth in our interventional radiology program, our vascular procedures and non-vascular and non-cardiac and vascular procedures. All that continues to grow. Outpatient visits for the month were 139 below the budget at 7,137, and our emergency room continued to be busy. They saw 328 more patients than we had anticipated in the budget in September at 4,586. Quick look at our cath lab activity. As I noted, our peripheral vascular and non-vascular activity continues to grow. Neuroradiology holding steady at about 3% in there, and cardiac activity at about 36% in the cath lab. Looking at productivity, our productive FTEs for the month were about 10.3 below the budget at 1,158.7. Conversely, our non-productive FTEs about 10.8 above the budget at 179.1, so we end up with total FTEs almost right on the budget at 1,337.8. Our full-time equivalents per adjusted occupied bed, which is our productivity measure for the hospital, pretty close to budget, a little bit below at 6.5. Moving into the financials. Total patient revenue for the month came in almost $7.2 million above the budget at $167,620,000. Our contractual write-offs for the month came in a little higher than expected at 77.32%. There is a reclassification impacting that number in the month of I think it's 3 patients who in a prior month came in as private pay, after discharge qualified for Medi-Cal. So we ended up with a reclass, and we'll see the impact on that in our operating expenses, a reclass out of our provision for bad debt and charity up to the contractual line, because they're now covered by insurance. About $1.7 million impact there. If you factor that out, our contractual rate for the month came in at 76.38%, so pretty much on budget for our contractuals for September. ending the month, we ended the month with net operating revenue almost right on budget at $38,200,000. Operating expenses about a little over $3 million below budget at $34,918,000. We did have about a 2.4% variance in our salaries for the month. Supplies in the month came in about $467,000 above budget. We saw that in the areas of cardio, supplies, and prosthesis driving the majority of that. But again, the story is in our provision for bad debt and charity. About $1.7 million reduction in that as a result of the prior month reclassification, but also our private pay revenue for the month came in at about 50% of what we had expected and what we've been experiencing. So I think you'll recall several months ago we talked about the second Medi-Cal expansion going on in California, and I think we're really starting to see the impact of that as our private pay revenue continues to shift up into Medi-Cal. So anyway, a good story for this month. We end September with an operating bottom line about $3 million above the budget at $3,282,000. Non-operating income for the month came in $409,000 below the budget at $676,000. That includes a unrealized loss in our investments of $420,000. And we, in fact, did have a realized loss on our investments of $467 in the month, which rounded to zero. So there was activity there. So we end September with a total bottom line from a Governmental Accounting Standards Board standpoint, which is I didn't mention this earlier, this is the presentation we use for our audited financials. Total bottom line about almost $2.7 million above the budget at $3,958,000. So nice to be able to report that number tonight. Quickly, we'll run through the Financial Accounting Standards Board presentation, and this is the way the financial markets tend to look at us. Our operating bottom line does not change, stays at $3,282,000. We pull out our property tax revenue of about $785,000 and our unrealized loss on our investments to come up with non-operating income from a FASB point of view of $311,000 and a total bottom line of almost $3.6 million in September. So are there any questions on September?
It's exciting. Nice month,
Yeah.
even though we had a $40 actual loss.
$462.
Oh, I'm sorry. Anyway, it was nice. Thank you, Chris. Nancy, if you could
I
present.
know that was a nice month, but I have to add a word of caution. With the shift from bad debt to Medi-Cal, as part of the Affordable Care Act, the feds have only agreed to subsidize that shift to expand the Medi-Cal program for a period of 3 years. So in roughly 18 months, that subsidy will no longer be in place. And it's a mystery to me what the states are going to do, what the state of California will do about that. So this is, one of the little ticking time bombs that sits out there, and we have more and more people being sent to the Medi-Cal program, and for the next 18 months it's subsidized. There's no indication that that will continue. So, we can't get too excited about the wonderful financials. We should enjoy them, but there's some storm clouds brewing. I want to talk about the preliminary results for October. We saw 997 patients, and they resulted in an average daily census of 152, about 1.3% lower than the budget, and 4.2% of the average daily census, down from that. The outpatient observation equivalent days of 289 were higher than what we had budgeted. We were looking at 188. We had expected our observation unit to be open by now. With the kind of utilization focus that we were putting on it, these numbers would have been down had it been open. We have yet to receive the approval from the licensure folks. They were here a week ago, and we're awaiting their answer. I'd also mention about the licensure folks, that when they came, they also looked at our proposal for additional beds in the neonatal intensive care unit. And one of the other things we showed them was our plan for how we would care for Ebola patients should they be presenting here. And the plan calls for moving patients immediately from the triage and registration area to a building adjacent to 1900 that can be equipped and function as the kind of intensive care these patients would require and would be separate from the hospital building. And they were actually quite positive about that. So I am anticipating that they'll give us that approval. We have a disaster drill pending statewide, and the subject is Ebola. And I'm hopeful that we'll be using that unit in the drill and testing it and learning what we need to know about things perhaps we haven't thought about. But we're looking forward to that. Based on discharges, the average length of stay for adults and children in October was lower than budget. Birthing center was really busy. We had 170 deliveries in October. We had budgeted for 153. October's deliveries resulted in 356 baby days of care. Our newborns totaled 172 this month. I was kind of curious about the payer mix in OB, and as it turns out, the vast majority of it is PPO, 73% of it. And the payer breakdown in the PPO is Blue Cross, United Health, Blue Shield, Aetna, and Cigna, in that order, with Blue Cross and United Health providing the lion's share. In surgery, we had 368 surgical cases, 7 cases below budget. We had cardiac surgical cases that were 7 above budget, neurosurgical cases that were 5 above budget, and joint replacement cases that came in 1 below budget. All general surgery cases were below budget by 18. Inpatient surgical activity was below budget by 29 cases, while the outpatient surgeries were above budget by 22. 715 cases were seen at the outpatient surgery center. They had budgeted for 593. For the month of October, total procedures seen in the cath lab were 687. We had budgeted 660. Overall cath lab volume for October a year ago was 686. Cardiac procedures this month were 5 above budget. Peripheral vascular procedures were 16 above budget. Neurointerventional procedures came in at budget. Non-vascular and other procedures were 6 above budget. Overall, the inpatient cath lab procedures were 20 more than we had anticipated, and the outpatient procedures were 7 more than we had expected. Non-emergency outpatient visits came in at 7,910, 230 lower than the budget. The emergency room recorded a total of 4,416 patients with a daily average of 142. This was 223 visits above the budget. The Washington, Warm Springs, Newark, Nakamura, and Ohlone clinics saw approximately 4,699 patients during October, 627 visits more than the budget. The total system emergency room and clinic visits for October were 9,115, compared to a budget of 8,265. In terms of personnel, full-time equivalents for the month of October totaled 1,328.8, including 12.9 agency personnel. This was higher than the budget of 1,274.3 FTEs. Our productive FTEs per adjusted occupied bed were 5.61 in October, which was above the budget of 5.54. I looked at where some of the overage comes, and As you know, I had mandated that everyone be trained in the basics of protective employee clothing and Ebola patients. So this is a little bit of extra time in training that wasn't anticipated. My plan is that there will be pretty much universal initial training, and then we'll select a group that will receive more in-depth training. In terms of patient mix, our preliminary information indicates that inpatient revenue for the month of October amounted to approximately $123.4 million. We had estimated in the budget that it would come in at $130.2 million. Of this amount, 56.5% was Medicare, including Medicare HMO, and 16% was Medi-Cal, including the Medi-Cal HMO patients. This compares with the budgeted inpatient revenue percentages that were just slightly different, 57.6% for Medicare and 16.6% for Medi-Cal. Total government program revenue for October was 72.5%. Let's see. Inpatient revenue for the month was under budget by $6.8 million, or 5.2%. Outpatient revenue was above budget by 14.4%, or $6 million. The inpatient revenue variance is due to lower census and OR activity, which drove lower utilization of ancillary services. Outpatient revenue was higher than budget due to increased activity in the OR, the cath lab, and the emergency room. In summary, in October, there were 13 less admissions and 207 less inpatient days than anticipated in the budget. Surgical cases were below budget by 7. Cath lab procedures were above budget by 27. Outpatient visits for October were 2.8% below budget. ER visits were 5.3% higher than anticipated. The clinic visits for the month came in above budget by 15.4%. Our total paid FTEs were above budget by 4.3% for the month and below the last 12 months average by 38.7 FTEs. Inpatient charges for the month were below budget by approximately $6.8 million. Outpatient charges were higher than the budget by approximately $6 million. Total hospital charges for October were below budget by approximately $800,000. On October 31st, there were 173 days cash on hand. The total days revenue and accounts receivable at October 31st was 67.09. When you exclude the Medi-Cal, the days in accounts receivable was 65.7, excluding the Alameda Alliance, which still is not paying its bills. The accounts receivable days were 54.2. During the month of October, $1,769,736 of charges were approved or pending for charity assistance.
This completes our open meeting agenda this evening. It's now necessary that we adjourn to a closed session. Thank you for your attendance this evening. At this point, we'll reconvene to our open session. And I want to report that no reportable action was taken during our closed session. There being no other action, no other agenda items this evening, this meeting is adjourned. Thank you.